health doesn't just happen. You're going to influence it. And so you much rather want to have a proactive approach, just like with your wealth, than reactive. Going to pay for it either today or tomorrow in some manner. You're going to pay for it.
Welcome to Swiss Money Secrets, your go-to podcast for insights on offshore investing and banking from the trusted Swiss perspective. Let's get into it.
Welcome back to the Swiss Money Secrets podcast. We're excited today to be joined by Kevin Bürchler. He's the CEO of SIP Medical Family Office. We're going to get into talking about health management services here in a bit for wealthy international residing people. Before we jump into that and I let you introduce yourself, Kevin, we're going to just talk quickly about some interesting news in Switzerland.
For once, it's not about politics.
Correct, yeah. So we'll avoid politics today, but we have the Schlitthornbahn that is just went opened.
Yes.
And Jamie, you are chief expert on cable cars.
Well,
so
I've
maybe you can
read one article, but it fascinated me. So it is the steepest gradient for a cable car. And it was open in Switzerland in December, and I have written down some notes. So the gradient is up to 159.4%.
Oh my gosh.
That means it's 1.6 meters of climbing per 1 meter horizontally. And you make 775 meters of like climbing up a hill in 4 minutes.
Crazy.
So I thought that was very interesting. So if any of our listeners are looking to come to Switzerland, maybe they want to have a ride in the steepest cable car of the world.
Yeah, that certainly. And I'm sure if we have any engineers listening, they can certainly appreciate some of those numbers, although we might not be engineers here.
Swiss engineering at its finest.
At its finest, the cable cars. Perfect. Well, I think that kind of covers it. So, Kevin, I will let you introduce yourself. Maybe you could tell our audience a little bit about who you are, how you became the CEO of SIP Medical Family Office, and kind of share a bit of your experience and what you guys do.
Thank you so much. Thank you for having me. It's a pleasure to be here and have this conversation today with you. Yes, really briefly about myself. My name is Kevin. I'm Swiss by origin, coming very traditionally from a Swiss family. Grew up on a farm with cows and horses and cattle and chickens, etc. That's where I come from. I am an insurance professional by training. I used to work at Swiss Re, but rather soon realized that the limits of a big corporation are too much framed for me, and that I want to be able to do more and do something more purposeful. And that's what I do today at SIP, where we are basically managing people's well-being, just like a traditional family office would do with the finance of international wealthy individuals. And so that's what we call health management, which actually I came into because of an own experience that I had myself. When I was in military, I had an ear infection, which was not correctly treated, and as a result I'm living with a ringing in my ears with a tinnitus for the rest of my life. And at that time I said to myself, like, this is incredible. It cannot be that due to a mistake or something that was not done for treatment, that you're going to live with that for the rest of your life, because the consequences are significant and quite impactful, even though tinnitus in your ear is quite small compared to other incidents that can happen. But that's where I found my purpose in trying to help people to avoid experiencing similar situations and to navigate through the healthcare system. And that's what we do at SIP.
Thank you so much for sharing that, Kevin. You already told me about that when we had lunch last year, and I was really fascinated because at WHVP we always enjoy working with other boutique firms, and I know quite a lot of like financial family offices in a traditional sense, but I've never heard of anyone specializing in health management. So I thought for our international clients or our US clients who are thinking about maybe relocating or traveling more, that could certainly be an interesting topic to cover.
Yeah, I think that's certainly a valuable, I guess, standpoint to look at how do I manage my wealth, especially when we get into the conversation of international business, travel, lifestyle, and certainly when you have a higher profile of wealth, your, I guess, flexibility to be in different places around the world increases. And whether it's in the Cook Islands, in my personal experience, I lived in the Cook Islands, or in Central America, or if you're in Europe, trying to understand different financial jurisdictions and the health jurisdiction. What are the regulations? What are they kind of presenting? And how do you navigate that? Certainly creates a lot of complications and a lot of work or due diligence to be done by someone who has to deal with that. So I guess I think something that I would be curious to know about is what are some of the challenges that you see to wealthy individuals who are traveling or potentially living in different places around the world throughout the year in finding proper health insurance? For instance, when I was in the Cook Islands, if you had lived there for longer than 6 months, you were on the universal health care there. So I could just go to the doctor and didn't matter. But that's not always the case when you're traveling 3 to 4 months here and there. So maybe you could, I guess, kind of talk a bit about those challenges and maybe some opportunities that exist as well.
Yes, for sure. I mean, it's incredible how intertwined health and wealth management are, because either one is absolutely essential to have or benefit from the other one. If you have an incredible wealth, and we see that very often with the type of clients that we look after, but your health is deteriorating, the question is, how much worth is your wealth still, and how do you put that into perspective? So I think it's a very important that both are pursued in parallel and approached actually quite similarly, because there's so many parallels in that, such as what you mentioned, for example, when you're relocating and the complexities that come with that, especially for an international family, the complexities of wealth management you're very well aware of, and that there's opportunities to be pursued outside your home market where you come from, but it always comes with challenges, and so it is with healthcare and health management. And I think in many instances it's very similar, the challenges that you come across. For example, having access and having the know-how in the jurisdiction where you're going to get to the best. How do you know, how do you know to get to the best sort of financial advice or financial actions to take when you're going abroad? And the same is also the case with your health. So when you're relocating, when you're looking to get medical care abroad, how do you know where is the best? Because if you have the privilege to be able to go international, it opens such a huge world of opportunities to yourself, because you might not have the best resources locally where you're coming from. Maybe you're blessed and you have, because you are in a certain area where you have access to that. But certainly when you open the scope and you see the potential outside, it massively increases the opportunities that you have. But you need to be able to navigate through those as well.
Yeah, go ahead, Jamie.
So how do the people go about that? How can you help them with that?
There's probably not a one-fits-all solution, but what we do is always based on, say, maybe I need to start with saying, what do we understand by health management? Because health management for us is finding a way to have a more strategic approach, a more systematic approach of how you're managing your health, similarly to how you pursue it with your partners and clients when it comes to wealth, because very often there's still the conception that health just happens, or until at least the point where you experience illness or a medical condition, when you realize it's actually not something that I can take for granted and I should be more proactive with it. So you need to do like a risk analysis to understand what risks do you face when you're, for example, relocating. Do you have your healthcare infrastructure where you're going? Like just your key contacts, that you get fast access to medical care. And when you do so and you relocate permanently, make sure that you have those contacts to continue either the medical care that you get at the moment, but to be able as well to access preventive medicine, to actually proactively help planning and organizing your well-being. So you need to have a sort of a risk analysis. That's what we do. And then you also need to set your goals, what you want to achieve. And that's, you might be able to share with me how you do that on your end, but I think it's probably very similar that you have to set certain goals to then define a strategy to reach there. And on the medical end, the very same approach can be taken as well. So you need to get an understanding in the most simple way of your family medical history, because not just because of genetics, but also because of your lifestyle. The likelihood that you experience something similar as your parents did is much greater than you experience something that's completely never been experienced within your family. So you want to have a very detailed understanding of that, and most cases make sense to have like a medical pedigree that you actually create to be to understand what risks you're exposed to.
Oh, I didn't mean to interrupt you. I just wanted to say that I think I really like what you said about having a plan and working towards that, because that's certainly something how we go about like creating our investment strategies. And I think also just sitting down and taking the time to think about everything while everything is okay and in order. And I think with wealth management, it's the same as with health management. If everything's good and everything's fine, that's the time to sit down and make a long-term plan. How do you want to create wealth? How do you want to preserve your wealth? How do you want to pass it on to your children? And I would assume that's similar to the same when it comes to health, right?
Absolutely, yes. But very unfortunately, when it comes to health management, a lot of people are still more reactive than proactive, as opposed to wealth management, where I would probably assume, because I'm not an expert in that field, that most people that have a need for it, or already at very early stages when you start to create your wealth, you're quite concerned with it, you're quite proactive in looking at the options to preserve or to grow, etc. When it comes to health management, I think only after about COVID, we've seen a bit of a change from people being very reactive towards the point where only once you get a diagnosis or you have a medical condition, you're going to look after your health. Whereas today we get more and more, depending on the country, but you get more a proactive approach of people, and especially of the younger generation, when we see that they're much more proactive in making sure that they also do their preventive checks, that they manage their lifestyle in order to achieve a longer life, but not only a longer life, but to preserve actually your well-being and quality of life for a longer time, obviously as well to enjoy for as long as possible the wealth that you have created, hopefully created within your lifetime.
Yeah, I think that's a really good point of looking at reactive versus active, management of whether it be your wealth or your health. When you pay attention to something, you will much more likely be able to manage it properly, learn from mistakes, learn from your successes, where we can move forward in that. And it also allows you to think even further outside of the box of, okay, if I know a pedigree in my family, let's say I have a medical condition that has shown up in the last 3 generations, well, okay, I want to prevent that, but what are side effects outside of that, and what can I do in my life right now, even though I don't have that, to control for those variables? Similar to wealth management of, okay, you might have made your fortune in your domestic country, but now you're at a point where maybe things don't, like, I need a bit of diversification. I need to look outside of the box of what I have been looking at so far to create a better profile for myself, not just for now, but for that sustainable long-term future, to prevent for these risks that I can now open my eyes to, because I'm not so focused on the momentary issue at hand. And I think that's a really interesting, I guess, parallel that would be brought up in that, in terms of health and wealth. And I think the other point to that is wealth and health are two things that can massively affect your kind of stress levels. Like, if I'm having issues financially, whether it's personal finance or investment, whatever, that can create a lot of stress. We know just from our simple understanding of healthcare, stress can exacerbate other illnesses, or I guess not necessarily chronic, but just our physical well-being. And so having those in order for me makes a lot of sense to say, okay, I need to sit down and proactively think about, how do I increase the quality of my life and not just try to increase the quantity of my life. I want that increased, but but that quality. And I think that's a big point. And I guess one question I would ask is how do you, I guess, from that risk management side, how do you make sure that your clients aren't being taken advantage of for whatever reason? How do you kind of mitigate that risk? Because maybe they don't speak the language of the new country that they're in. They don't understand the medical service practices, what the regulations are. So how do you guys go about really kind of putting those guards in place?
Mm-hmm. Yes, and again, there's probably another one fits all solution or answer, because it's extremely individual, and depending on your individual factors, how you're going to manage those risks, but also especially as a wealthy individual, wealthy family, where you're very much and very often sort of in a position where you're trying to be taken advantage of, because, or at the point where people are aware that you have a certain financial strength. And maybe you'll be able to share some examples of how you see that on your end, but certainly I can share on my end. When someone out of a wealthy family is accessing medical care abroad, and a hospital or a doctor would know, very quickly the tariffs change, because it's no longer within the domestic regulation frame of the tariffs that should be applied. And sometimes there is horrendous things happening, such as that tariffs are just added another 50%, or maybe added another 100%, depending on the individual that is coming for medical care, which is, in my view, ethically quite questionable. Certainly there is a point where you have to say, if you're going to take capacity of a foreign country because they might offer better health care services or quality away from the domestic market, there is a premium to be paid for that, but not in such an excessive manner. And for that, you simply need to have someone who is aware of that. So a lot of that risk prevention has to do with awareness and education. We see that people that are aware of the risks that they face in the healthcare system and the dynamics of how the healthcare system works are much more protected, or taking much better educated decisions in that. So when you take a sense of ownership of your health, compared to people that just basically follow the flow without really understanding all the dynamics that are happening within that market. And I think when it comes to being taken advantage of and trying to manage the risk, one of the things that a lot of people are not aware of that is that when you have private insurance, you're actually much more exposed to being, for example, overtreated. Very interestingly, there is some statistics that confirm if you have private insurance, you get around 33% more cardiac surgeries, which is not because your body is just physiologically different compared to someone who doesn't have private insurance, but it's obviously because healthcare participants have an interest in benefiting from the pay that can be gotten by a privately insured person. And that's not to say that private insurance is not good. It certainly is, because it gives you access and removes certain limitations that you otherwise have. But you need to be aware that this could be the case, and you need to be aware when you're entering that healthcare system that this is something that you're obliged to manage, or you're obliged to seek for someone who is going to guide you on that, to not be taken advantage from. And I guess that's very similar to
it actually it is. It's super interesting, because we, as you know, we work mostly with US residents who are looking to internationally diversify their assets. And one big concern that a lot of our US clients have is privacy protection, for the exact reason that you mentioned. If you have a lot of money and that's visible, it puts a target on your back. In the US, that could mean a frivolous lawsuit. It could mean many other negative things. And a lot of the clients that we work together with are looking to make their wealth less visible. Of course, not towards the IRS. We always have to say that. They still pay taxes on the accounts that they have offshore, but noisy family members or neighbors or information brokers, they cannot pry out any financial information out of their bank statement. So that's a very interesting parallel. And then the other thing that we can certainly relate to is the educational part, because offshore banking, the business that we are in, there's so many misconceptions, and a lot of people have very wrong ideas. They think it's only for hiding money, or it's for only the ultra wealthy. And for us, it's super important. It's also one of the reasons why we started this podcast, is to just shed light on what we do and explain what the options and services are out there, because there are scams, and it's important that you find the right people who are able to locally guide you through the system. This is what we do with Swiss private banking, right? We introduce the clients that we work together with to our partner banks in Switzerland, because we speak the language here, we know the laws, we are in the right time zone, we can just walk over to the bank and take care of things in person, and that's very valuable for someone who's sitting in another country. So it would be interesting for me to hear a little bit more about a typical client that you work together with. Do you also have certain nationalities, certain jurisdictions that you are more familiar with? Do you have a typical client persona, or is it really all over the place?
It's very, very diverse. One thing that I can share, which maybe relates to you, is during or after the recent US election, what we've seen is a massive surge from requests coming out of the US for people that are potentially looking to relocate, looking for international private medical insurance abroad. Yes, which is a very big topic usually for Americans that are relocating because of the specialties of the US healthcare system and the US health insurance system as well. So this is something that we've observed there, and we have quite a few at the moment of people that are coming from the US but are looking to potentially relocate. But there is not an actual persona of the type of clients that we look after, except for what I would probably say it's always people that have very much a priority on their health. And that could be at either stage. That could be someone who is just aware of the value of their health, and they've done their preventive work and their sort of health management privately or maybe within their family office so far, but they're looking to outsource that to, let's say, a professional medical family office, because the family office has been concerned in screening, for example, doctors and specialists in the past and comparing first, second, third medical opinion or similar. But all of the clients that we would look after, they have an interest and they know the value of their health, and they're willing to invest into that, not just in terms of money but also in terms of time, because there is not a way to manage your health where you just invest certain type of money. You actually have to take active ownership of that, otherwise it's not going to happen. But people will need guidance on that, and setting up their insurance when they're relocating, having their healthcare infrastructures, their doctors in place, carrying over as well their medical records and medical files, which is a big topic as well, very underestimated in many scenarios, because people organize as well their assets quite well, and there is tools for that. But when it comes to their medical records, it's usually spread all across the world, a bit in the US, a bit in maybe Athens, a bit in London, but no one has central ownership and overview of the family's medical documentation, which can be in some scenarios quite key to have access to.
So do you guys help facilitate that, or like how do you work with your clients in building I guess that their network is also connected to each other? I mean, there's obviously a lot of regulations about privacy and sharing of that information. So is that something you guys do as a family office, is try to coordinate between those parties? And I guess a follow-up to that question is how do you guys vet the network that you guys then work with to offer to clients for these types of, I would say, services or health plans?
Yes, so when it comes to the medical data, what we first and foremost do is to encourage absolutely everyone to make sure that they own their medical data, and that's what we do on a daily basis in every conversation, just as we have it today, because it's something that's actually quite simple. It requires time, it requires a bit of organization to have that organized and structured at your place or at your access. But then if someone is not wanting to do that themselves or himself or herself, then we're here to help with that. And so we can arrange to collect all those records from the past 5 years or 10 years or whatever it might be. But in the first case, what we always recommend is for anyone, whether it's people are clients of ours or not, is to make sure that you realize the importance of that and that you take ownership of it. And the way that we vet our specialists or our medical network, I guess that's probably the most tricky question that you can have. And again, I see a lot of parallels to finance and to wealth management, because how do you trust the person with whom you're investing your money? How do you find out? And I've actually made experience on both ends, on the wealth and the health management side of things. When I did my first investment, after a few months, I've actually realized that the person that advised me wasn't really working purely in my interest, but also had his own interest and his own income to make. So it was probably not the best decision that I've done at the time, which is all right, because some money is lost, you can regain it again, but in an instance of health, sometimes you don't have a second chance to revisit that, because once you have the tinnitus, you have the tinnitus. So you need to be quite careful, and it's probably the way that we do it is based on 3 factors. So one is experience based. So obviously we have a network with specialists and doctors we've worked for quite a long time, where you also know, and what is always very, very important, is like the ethical standard and the purpose of a doctor or a facility that is that we're working on. Because is someone actually working in the interest of the patient and is willing to go beyond the time that can possibly be charged, and is willing to be there when a person has a concern? And then we do 2 or 3 other types of vetting the people that we work with. But for us, what is very important to realize is, again, you probably only have once the experience of maybe a cardiac condition, or say a cancer, or you have only once the chance to try to avoid dementia or Alzheimer's. Whereas with finance, it's possible to try and test here and there and see what is the results, and then go for what is most suitable to you. In health, you don't always have that, and so that's how we've basically institutionalized the experience from working in that for a long time already, and with many cases, to be able to do this experience-based vetting that an individual will never be able to do.
I think one aspect is very similar in terms of we have also been in business for a long time, have a long track record of partners that we work together with, but at the same time, the financial industry is extremely highly regulated. So for a company like ours, we are licensed in the US, but also in Switzerland, and we have to adhere to all the rules and regulations. There's a lot of documentation, and we have a lot of compliance paperwork that we have to give out to clients to just show that our company is in good standing, etc. The same, of course, goes with the banks that we work together with. They are even more highly regulated. Is there something similar in the field that you are in, or is the industry less highly regulated than what we see with finance?
There's 2 sides of it. So when we're talking about insurance, it's very regulated. So we are regulated here in Switzerland. We're regulated in the European Economic Area. We're also regulated by the FCA in the UK, for example, to be able to advise people on finding the right international private medical insurance. You need to be regulated. Now, when it comes to our medical concierge or to our health management services outside of that, it's not regulated at all, which has its benefits, but also has its disadvantages, because you have a lot of cowboys in the industry as well that are, I would so-called medical tourism agents, where you're facilitating access to a person from abroad to medical care, and you usually get a commission or a kickback from a hospital or from a doctor, which again a lot of people are not really aware of. But if you enter such a relationship, if you entertain such a relationship, you have to be aware that the person on the other end who's advising you has also a personal financial interest, because they have to pay their rent, they have to pay their bills, they want to make some money from investing time into you as well.
Yeah, I think that's a really interesting point, because that's even though it's unregulated, and as you quote unquote call them cowboys, which I really liked, by that. It's great similarity. But we also see that in the finance world, where if you don't have an independent wealth advisor, you don't know what your financial advisor's agreement is in the context that you actually brought up about your investment, that you didn't know that the person that advised you on that certain investment was actually getting a commission or a kickback from that underlying investment. And that happens in the finance world all the time with non-independent wealth managers who are connected to a bank or a subsidiary of a bank. And in their contract, they get commission based off of how much revenue they bring that company. And so there might be their head bank is creating a investment tool. It might be a good investment. I'm not saying it's always a bad one, but there's still kickback coming back. So the price that they say, okay, this is what it costs you to manage your account. And so you think, okay, well, this is what I'm paying this person to manage my funds. It's actually, when they put money in certain investments, they're getting kickback underneath through that. And that's in a regulated market, so there's this conflict of interest. So even in the unregulated market, it exists, but even in the regulated market, it exists. And that's something that people, like you said, you need to be aware of it. You need to take the time to be educated and understand these things.
Yeah, and sometimes we have discussions with people who see that the fees that they pay in Switzerland are a little bit higher than what they pay in the US. And that's one of the points. It's like, yeah, but if you are only paid by the client, it might be a little bit more expensive on the upfront, but you know exactly like where the financial advisor is getting paid from, and you have full transparency over how those fees are generated. And if you pay a little bit less on the upfront, and then either in the background your data is being sold, which unfortunately also happens in the US, or then your financial advisor opens their hand to everyone left and right, that might not be in your best interest at the end of the day, even though on a first glance it might look a little bit more expensive. It might be a lot more beneficial to you in the long term.
Yeah. You're going to pay for it either at the
exactly.
beginning or at the end, but
Yes.
you're going to pay for the service. Yeah.
So maybe on the note of payment, how do people pay you, or like how is your business model set up, just so people have an idea of the types of relationships you entertain with your clients, maybe?
Yes, that's a good question. So when it comes to the insurance, it's quite simple. We are an independent broker, a regulated independent broker. So we get paid by a commission from the insurance company, which is, for everyone to know and to be aware of, because it's important for people to be aware of. So people don't pay us directly for the advice that we share to them, but we're being paid by the insurance companies for the service and the advice that we provide. When it comes to the medical concierge service, it works slightly different. And I think at the very beginning, one of the most fundamentals that we have established when we've set up this product or this service is that we don't want to be a medical tourism agent who's taking kickbacks and commissions. So that has been basically our utmost priority and ethical standard, that we've said we need to find a model so we're not running off that and we don't have a conflict of interest. And so in the end, what we do with such clients is we subscribe to a membership where people pay us an annual fee, and they know very precisely what they pay for our service, and that's what we get, and full stop, that's it. And even sometimes we get commissions and kickbacks from medical providers, but those will be given back to the client because that's just the way that we finance ourselves. And the feedback to that in the first instance, when someone is experiencing that, okay, someone is actually giving me back money that they've already had on their account, is like incredible, because people realize that we're not in here for the quick buck, but we're actually here to create a sustainable model to help in the utmost interest of someone. So this is the model that we pursue in this end. And I agree, sometimes people are maybe not shocked, but they're surprised about the fee in the beginning, because it comes with a cost. But as said, you're going to pay for it either today or tomorrow in some manner. You're going to pay for it.
Yeah, I think that's a really good point. I think if you have any kind of, I guess, final kind of point that you'd like people to understand, we can go to that, and I'll let you kind of finish that off.
Yes, sure. I mean, well, for me, what is the most important, just in general, is that people realize that they have to take a sense of ownership of their health, because health doesn't just happen. You're going to influence it, and so you much rather want to have a proactive approach, just like with your wealth, than reactive, and you just wait to hit the wall and then try to react to it. So take a proactive approach and consider, what is outside of the box, I would say, because very similarly to how you're managing your wealth, there is, the same approaches you can apply to your health. And maybe if I am allowed to share one more question that I would actually like to ask you is, this topic of longevity is quite big at the moment. We're actually going to have a conference around health and longevity here in Zurich in April, and very much as well in the sense of no nonsense longevity, because there is a lot of marketing around that and not everything is really science based. But what is a big topic is always, when you're expecting to get 100 years or 110 years at good health, so you're striving, you're going to get out, you're going to use money to enjoy your life. So how do you plan for that, and how do wealth managers take into consideration, maybe already today, what is it as a consequence or as a result if someone is all of a sudden expecting to turn 10 years older, and how do you plan for that? That's quite a highly debated topic with us at the moment, also when it comes to insurance. But while I'm here with the expert, it would be interesting to see what you see going on in the industry so far, and what you expect maybe that will happen on that front.
I love that you throw that question to us as like a final send-off, and it could be like an entire 4-hour conversation separately.
Maybe it's our next podcast.
Yeah, exactly. Maybe we'll have to have you back. Personally, I find the topic of longevity super interesting. For us, what I can say as like a wealth management firm, all the portfolios that we put together are tailor-made. So we always take into consideration things like age, time horizon, the health of the client, how much liquidity needs they have. So I think if the age or like life expectancy goes up significantly, that's certainly something that's gonna influence how much risk the client is willing to take, what kind of liquidity needs they have. So this is something that on a case-by-case basis we are certainly gonna look at. Now, the thought of people living to 100 or 110 on average, I think that's not something, honestly, that the wealth management industry is going to lose sleep over, because especially in Switzerland, we are notoriously conservative and sometimes a little bit slow to move. So I think we're not really early adopters for trends like that. And I don't think that right now, with everything that's going on with regulation and AI, that longevity is something that's like super on top of the mind of the wealth management industry, I would say. Like, let me know if you disagree.
A little bit.
Okay, well, I'm very excited to hear that. And then maybe you can also share a few more words about the conference that you're hosting in April, because most of our listeners are based in the US, but maybe someone has a spring trip planned here, or maybe some people from Zurich are listening as well. So maybe you can send us off with that. But first, Jess, please disagree with me.
Yeah, so just sum it up quickly, because we've been here for a while, and I think there's been a lot of really good information. I don't want to overbear it. Longevity is thought about in wealth management. Now, I think it's also kind of to your point of, you have to a certain extent, understand your financial plan. And that's going to come more on the financial planner side as opposed to the wealth manager side, because often what a financial planner will do is they'll look at everything A to Z, what I need for my income each year, what I'm going to need for my expenses of insurance. Am I over insured? Do I have too much insurance? Do I not have enough? What are my retirement goals? Are these retirement assets? Is this just a nest egg? So in the financial planning side, certainly that's coming into play, and that's stretching things out, I would say. In terms of building a nest egg, that's what a nest egg is there for. That's why you build it, is to have money set aside somewhere else that can grow, that I don't necessarily need, But if I do live another 10 years, I might just need that nest egg. And that's part of the purpose of what we do here is we want to diversify. When you hit a certain level of wealth, you can only diversify so much as an American just in the US. But you also have this incredible ability to go and open a Swiss bank account or a Liechtenstein bank account, use a wealth manager who's specialized outside of the US, so I can diversify my structure and physical where my assets are, and then diversify even further in other currencies and other companies that might not be listed in the States at all, but still have a good profile. And I can let that grow, and it's my nest egg, and it's not outside of my wealth picture, but it's not something I'm necessarily depending on right now or in the next 5 to 10 years. If everything works out perfectly, I want to pass it on to my next generation as that nest egg, and you can build 2 nest eggs. You can have one in Switzerland, you can have one in the US, and that's their purpose, so that should I need it, I have it. And so I think you're right to a certain extent. In Switzerland, wealth managers aren't necessarily thinking of that next 10 years, other than I hope to keep my client for that next 10 years. But still, that's the whole principle of the nest egg idea, is for those unexplained, unplanned, longer life. So maybe you could finish us off there, telling us about your conference. Just before you jump into it, all of that information will be in our show notes for our listeners. So I'll let you launch into that.
Thank you. Yes, maybe we can share the link as well to that, where people can see the full agenda. But I think what is interesting, the approach that we're going to take is really, and I'm sort of repeating on that no nonsense health and longevity, because there is so much going on in the industry, and it's very difficult to classify what is sense and what is nonsense, what is scientific and what is not. So at the conference, we're going to speak more about, let's say, 2 sections. One is more really the clinical part of it, where we're going to address prevention of Alzheimer's, dementia, how to manage if someone in the family has an addiction problem, for example. Also, what impact does it have to your advisor at the bank or the wealth manager if someone of the family has an addiction, and that can be quite crucial and changing. How do you manage capacity? And so then we'll go on to more clinical topics, such as the most latest longevity treatments that might be coming the next generation, that is of interest to be observed, which is no nonsense, actually. And so one of the topics I'm very much looking forward to is we're going to have one of the latest and furthest developed providers of stem cell treatment at the conference, which is incredibly fascinating. And we're going to hear a bit more about where it's already applied, where can it be applied, and also from a regulatory perspective, where can you access it and where can you not, because in most countries today you can still not. So if anyone of your audience is interested to join the conference, more than happy to see them there and continue that conversation.
And it is when and where exactly?
It's going to be on the 3rd of April here in Zurich in the Park Hyatt Hotel.
Fantastic. Kevin, thank you so much for being on the show. I really appreciated learning more about what you do.
Thank you both. Much appreciated.
Thanks again for joining us on this episode of the Swiss Money Secrets podcast. If you would like to learn more about WHVP and what we do, check us out on our website at whvp.ch. Or you can check us out on any of our social media handles on LinkedIn, Facebook, YouTube, or Instagram by simply searching WHVP. Have a great rest of your day.